Hi, my name is Dr. Claudia Anderson from Family Dental Care Park Ridge, and I'd like to welcome you to Word of Mouth Wednesday. It's been crazy weather out. I know that most of you have been paying attention to the Chicagoland area being hit by the blizzard of 2011. So first of all, I'd like to tell you that I hope all of you are being safe and have been safe, and that this blizzard hasn't found you in any difficult situations. So we're thinking of everybody. I know we're pretty snowed in where I live, but it's kind of still fun, so I'm not really tired of it, and it's quite beautiful actually. So today I'd like to talk about wisdom teeth. There's a lot of ideas about what we're supposed to do with our wisdom teeth. A lot of patients feel that when they hear that their wisdom teeth are coming in, that automatically they need to have them removed or extracted. Let's talk a little bit about when the wisdom teeth come in. For most people, the wisdom teeth, if they're going to erupt, come in at the later part of our teen years, so 18, 19 years old into the 20s. Sometimes you'll see people get their wisdom teeth earlier when they're 15, 14 years old, but typically it's the late teens into the early 20s. That is if you're going to get your wisdom teeth erupted. A lot of people never get their wisdom teeth popped through the gums, and so the only reason that we know that they may have their wisdom teeth is by taking x-rays that determine and show us that in fact you do have your wisdom teeth. They just don't want to come through. And there are people that have just one or two wisdom teeth, that they just never developed wisdom teeth. That's not an uncommon thing, and it's not a bad thing. So you'll find people that have one wisdom tooth or two wisdom teeth or three, but not all four. And that's a very common occurrence actually. So the question becomes, when do we think about having our wisdom teeth extracted? When does the dentist tell you to have your wisdom teeth removed? And there's a wide variety of thought on that, and you're going to talk to one person who says that they should do it this way and another that says that they should do it this way. I'm going to give you my rules of thumb that I have worked with for over 20 years on what works best. One of my first criteria for suggesting to a patient that they have their wisdom teeth removed is if they've had orthodontia. And orthodontia just means having gone to an orthodontist and had braces and had their teeth straightened. Because many times, not always, but many times an orthodontist at the completion of the patient's case will look at the situation and say, I think it would be best if you had your wisdom teeth removed because it's going to decrease the amount of crowding that may or may not occur after all of this time and money and effort was put into having your teeth straightened. And I concur. I think that that's a very reasonable request. And so I'll sit down with the patient and we'll talk about why it would be to their benefit to have their wisdom teeth removed after going through the braces and having this lovely smile. Another time that we think about having wisdom teeth extracted is if you've got impacted wisdom teeth. And impacted wisdom teeth can either be impacted fully into the jaw so that you see no part of the wisdom tooth erupting at all, or it can be partially impacted, and that's when part of the tooth might be appearing in through the gums and you can see it a little bit. But impaction can cause problems to the teeth that are in front of the wisdom teeth. They can cause pressure. They can cause bacteria to be allowed in the soft tissue between the impacted wisdom tooth and the healthy tooth in front of it, risking that healthy tooth in front of it to the potential of decay. So if there is an impacted situation and the patient has symptoms, and from x-rays we can tell that there's potential damage to other healthy teeth, then it would be to the patient's best interest to think about having those teeth extracted. And so again, we sit down with the patient and talk about the pros and cons of having the teeth extracted versus keeping the teeth, and we work with the patient together and letting them make their own decision. The third time that a dentist and in our office we would suggest that maybe a patient think about extraction is if they have all four of their wisdom teeth, they're in their mouth, they're functioning fine, they're able to chew with them, they're not causing the patient any pain. But when the patient comes to the dentist, to our office for cleaning and for checkups and for any work that needs to be done, we assess that those those wisdom teeth are not being cleaned well enough, that the patient is just not able to get all the way back there in that corner of the mouth with the toothbrush and clean those teeth adequately. Even with repeated instructions and demonstrations as to how to do this, sometimes it's just physics that you just can't get back there adequately and keep those teeth clean. And as a result, those wisdom teeth start to decay. They start getting cavities, and you may not even be aware of it. So in those particular cases, again, we'll sit with the patient and say, look, this is what's happening. This is what might be best for your overall dental health. That removing those wisdom teeth might actually improve the dental health that you are experiencing. So those are the criteria that I generally look at when thinking about extracting wisdom teeth. If a patient presents to me with all 4 wisdom teeth, they're clean, they're healthy, they give them no problems, in my opinion, they can be left alone as long as they're not symptomatic and as long as they are not affecting adversely the overall dental health. So that's my discussion on wisdom teeth. I hope you feel wiser, and I'll look forward to talking to you at our next Word of Mouth Wednesday.